colleague Staker here with Westside-Medical. Today we're going to talk about stuff you can do to keep your shoulders healthy for bench press. Now the bench press isn't a bad exercise. It's a great exercise for developing strength. It's one of the big three exercises that you need to do. But when you bench press, it's an example of repetitive stress. And so you put your body through that stress of benching, and your body then develops up to be better at that stress, so you get like thicker muscles and you get stronger. But you also need to stay focused on what it does to your anatomy from a biomechanical standpoint. So if you're doing a lot of bench press, these anterior muscles, they're going to get tight, and it causes the humerus head to be pulled anterior, so it's not properly lined up in the glenoid cavity. And so when you have that, you have a chance of impingement issues here, as well as some arthritis in the AC joint and rotator cuff injuries. So in this video, we're going to show you how to stretch out the musculature so you can keep your shoulders healthy for the bench press, as well as exercises you can do to strengthen this posterior area here to help pull the head of the humerus back where it needs to be, so it's in the biomechanical correct position. So first we're going to talk about how to work out the pec muscle. Now the pec is made of two muscles. You have your pectoralis major and your pec minor. So first, to work the pec major, we're going to compress the tissue. We're going to first shorten it. So you want to internally rotate your shoulder, then you're going to compress, and then you're going to externally rotate, and you're going to go through the whole entire muscle belly. So shorten it, compress, and then traction. So shorten it, compress, and traction. That's for the pec major, and that ties on to the anterior part of the humerus, which causes the internal humerus rotation there. Now the pec minor actually lies underneath the pec major, and it ties on to the coracoid process of the scapula, and that's going to cause the shoulder to kind of ride up, and that's where you get some of the AC joint arthritis that can cause some fraying in that rotator cuff. And so to work that, you want to push the shoulder blade kind of down, compress that pec minor, and then you're going to lift it up. So compress and lift up. Compress tissues of the pec minor, then you're going to traction it out. So we do this by using a wall and a crossbar. So I'll demonstrate the left pec here. So first, take the ball, push it against the wall here. You're going to find like a tender spot through there. So you're going to compress it, and you're going to externally rotate that shoulder. So compress and externally rotate. Good. Now for the pec minor, you want to get underneath the pec major. You're going to compress it, then you're going to lift that shoulder blade up. So compress and lift it up. Good. Now the next part, we want to work out adhesions in the rotator cuff itself. So we want to work on external rotation and internal rotation. So you're going to take the crossball, you're going to first find the tissues that are tender, you're going to compress, and then you're going to internally rotate the shoulder. That's going to really loosen up these muscles here, like the supraspinatus, some of the infraspinatus muscle there. So if you zoom in, then compress, and then internally rotate that shoulder. Good. Like that. Now we're going to do the same thing for the posterior, right back here, but we're going to compress and we're going to kind of externally rotate it like this. And that's going to work that teres minor, where it ties into back here, as well as the posterior delt. So once again, you find a wall, compress that tissue, so you can compress, and then traction it. Compress, traction, compress, traction. You kind of just can kind of play around with where you feel those adhesions. So when you find one, you can do a little bit of cross friction, a little back and forth on it, or you can compress and then just traction, pull it through this range of motion. The biggest thing is, if you find a tender spot, you want to really work it for a couple passes, just really stretch out those adhesions there to work on the biomechanical function of that shoulder joint. Good. So the next muscle of the shoulder complex we want to work is the levator scap muscle, and it runs from the base of the neck to the tip of the shoulder blade. So you're going to compress, and you're going to lift your arm up, and that's going to pull that shoulder blade down, stretching the levator scap muscle. So once again, zoom in, You're going to find that levator scap, find the tender spot, going to compress it, and you're going to traction that muscle through that motion. Compress and traction. Good. So now that we've cleared out all the tension of the shoulder complex, now you want to strengthen the posterior part to pull that humerus back. So first we'll start off with these pull aparts. Real simple, just like this. That's going to work the posterior rotator cuff as well as between the shoulder blades like the rhomboid and the lower trap. And a variation of this, you can pull it behind the head also, rolling those shoulder blades down. Like that. Once again, it's that posterior rotator cuff and the lower trap. Good. Another one here from the standing position, you can take the band, you get these bands at Westside Barbell, and you just do a simple lift with it like this, and that's really going to work on the whole shoulder complex. It's going to work on external rotation as well as that scapula retracting down behind the shoulder. It's going to lift up just like this. All right. Next favorite of mine, we're going to call face pulls. Take the band about face height, and it's going to pull back. Make sure you really retract those shoulder blades. Pull it right to your face. Really hold that. That's going to roll the humerus head back into the glenoid cavity. Right through here. Good. And then a variation of that to work more of the rotator cuff. You're going to pull and then externally rotate like this. So you're going to lock the scapula down, then externally rotate. And that's going to hit more of this rotator cuff. While you have this band set up, it's also nice to do some just global stretching of the shoulder. So you're going to hook it here. It's going to work on your external rotation. Make sure you hold it for 2 minutes at least. That's what time you have to hold to get the tissue change. So this here is external rotation. Nice stretch. Hold it. And then you work on internal rotation. Once again, just let that shoulder internally rotate. It's going to stretch this rotator cuff as well as these neck muscles and the scaling muscles. Once again, 2 minutes. Good. So hopefully that helps you guys. Remember, do that to maintain a strong bench press as well as keep those tissues healthy so you can bench for a long time.